next question that came in, pre-assessment for the annual wellness visit. Janice had asked, can a nurse see a patient for a pre-assessment for an annual wellness visit before the provider sees them and bill a 99211? The providers would like a nurse to see the patient in advance for the questionnaire and history forms before the preventative exam. Well, the thought process from the providers is that, can we just have the nurse help the patient fill out the documentation before the annual wellness visit, and we'll just bill a 99211, which is the universal nursing visit code. Well, there's a problem with that. Now, some of you may be thinking right away, hey, I see lots of problems with that. Or, oh, that makes perfect sense because the nurse can do this and the provider just has to be there. They're just filling out forms. The problem with this, though, is that anytime you want to bill out a CPT code that's an E&M code, and that's what this is, then services that don't document or demonstrate that an E&M service was performed and necessary will be denied. So there's a reason why it's an E&M code. It can be a nurse's visit, but it still has to be an E&M visit. And they said, well, can we just take their blood pressure? No, it has to be medically necessary. And therefore, if you're just there to fill out forms, that's not medical necessary. Now, let's talk about what it cannot be used for, and then we'll talk about what it can be used for. If you just need administrating routine medication, no, you can't do that. If you're just checking a blood pressure, no, can't do that. It's got to be management of a condition or illness. That drawing for blood, or when you do other diagnostic tests, whether or not a claim for a venipuncture or diagnostic test is submitted separately. Faxing medical records, no. And that, I think they should probably put right there, filling out medical paperwork, just telephone calls, checking on reports and labs, diagnostic and therapeutic procedures that are not reimbursed, or usually not reimbursed. You can't do those. Recording labs in the medical record, just putting them down, reporting vaccines, or writing prescription when no other E&M is needed or performed. Again, it has to have an E&M component to it. But what can you actually use it for? Well, you have to have an E&M. And you have to ask yourself a few questions. And I always this was from an article, and I really like the way they led with this, because this is kind of the way that it helps me when I need to determine if a code is medically necessary or not, or if it's the right code, or if it's even ICD or CPT. I say, ask yourself this. And then if it qualifies, okay, then you can go to the next step. And that's exactly what they said. Ask yourself this question. Is the purpose of the visit to provide a patient care that influences a physician's medical decision making? Now, you think, well, you're filling out the paperwork. But are you providing patient care? No, you're filling out paperwork. Okay, that's not providing patient care. And is it needed for the patient's education? You could say, yes, we're filling out the history for the annual wellness visit. Isn't that part of education? No, it's not. What's the medical necessity? Remember, the annual wellness visit, usually you're not going to find it. You're not finding and treating something for that patient. You're checking the patient's progress or standard, and then every year you're doing that. So again, go back and look at the reason why Medicare requires an annual wellness visit. And usually your patient is asymptomatic. Now, that doesn't mean that they don't have conditions like high blood pressure, diabetes, hyperlipidemia, COPD. They can have those things, but that's not the purpose of the visit. And then to prove medical necessity and overturn a denial, you'll need to keep detailed documentation. And in that documentation, it's going to require what's the reason for the nurse visit? What's the plan of care? Well, there's no plan of care for filling out paperwork that you need for another visit. Patient's diagnosis, there's no diagnosis to fill out paperwork. The dose and recent labs. Let's see. Oh, today's presentation, health status, new education. Now, if you're educating the patient on information about medication, okay, that you could do that. However, they haven't seen the provider yet to get new medication, so that won't work. And also, you need to have the credentials of whoever's doing the visit. Actually, this doesn't have to just be an RN visit. It can be an LVN visit, LPN. It can be an MA visit. Again, it's a face-to-face staff that you're doing this visit for. All right, I hope that explains where the hiccup would be. But this article also went on to show routine services that are medically necessary, and the examples that they gave were, and I probably should have spaced this out a little bit better or put them in bullet form, but a follow-up visit for a weight check on a patient recently placed on a new medication known to cause weight gain. Yes, that's perfect. An BP established patient requesting a follow-up on his blood pressure. And we've got discussion of patient in-person follow-up of lab work, suture removal, diabetic counseling. That's non-repetitive. All right. It's not diabetic counseling that you give every single time they come in. This would be unique, like recently diagnosed as a diabetic, switching from oral medication to insulin, getting a insulin pump for the first time, things like that. Dressing changes for an abrasion or an injury, that would work. Nowhere are you going to find anything that states helping the patient fill out their paperwork before the annual wellness visit. Now, is there things that you could do here? Yes, but I still don't see that link to the annual wellness visit. I could see you linking it in other ways for other visits that are symptomatic visits, but annual wellness visits are supposed to be, we make you come in for this visit to see how you're doing, not expecting to find something new. All right.
Do you need more medical certification and business training? Learn more at www.cco.us.